President Pam, fellow Rotarians and guests, I am so excited today, and I know you are too. We have a special treat. Jena Hausmann has served as President and Chief Executive Officer of Children's Hospital Colorado since 2015. Children's Hospital Colorado is a leading pediatric healthcare system, 100% dedicated to the health and well-being of children, adolescents, and young adults. Consistently acknowledged as one of the nation's top pediatric hospitals by U.S. News and World Report, Children's Hospital Colorado is recognized nationally and internationally for its medical research, which that piece will, I think, surprise you, how much research is being done there, along with education and advocacy programs. She joined Children's Hospital Colorado in 2004 as Vice President of Strategic Planning and Network of Care Operations, and assumed the role of Senior Vice President and Chief Operating Officer in 2008. Now, I checked with our old friend Fred Grover to just get his input before making this introduction, and think about how complex an organization like Children's Hospital Colorado is. All of the different pieces and parts and constituencies within that organization. But according to Fred, the most important defining characteristic of Jena is her connection to people. She is a people person first and foremost. On a more personal note, we entrust our children and our families, as Jim had mentioned earlier, to Children's Hospital Colorado, and by extension, we entrust with them a portion of our futures. To know Jena Hausmann is to know that our futures are in good hands. Please welcome Jena Hausmann.
Wow. Every part of your weekly meeting has been inspiring and touching already. I don't think I could have asked for a more beautiful way to capture the essence of Children's Hospital Colorado than the way you opened with the essence of magic. And thank you for the humbling opening remarks. Often when I get a chance to speak about Children's Hospital, it's a gift for me to tell this incredible story. And I always try to share that I really fundamentally believe, and I think all the people who work at Children's Hospital Colorado fundamentally believe we are owned by our community. We are our community, a reflection of our community. And even though we're a complicated business in a really crazy industry right now, we never lose sight of the sole purpose, the essence of our mission, our origins, and what is truly important. And so when John and I were batting around ideas, we wanted to kind of blend this sort of sense of serving and service that is in both the Rotary's mission as well as Children's Hospital's mission, and talk about community. And I was reflecting on how many communities I think Children's Hospital is a part of. So I'm going to weave together a story, a little bit of our history, our impact, and talk to you about the 6 communities that at least I can define. We know that we are a family within ourselves. There are 10,000 plus team members now that make up the family of Children's Hospital Colorado, and they are exceptional in not only their brilliance, their heart, their soul, but what they know about medicine, science, and taking care of children. Second community is Denver. It's our origins. It's where we came from, and it's where we still serve the primary number of children we take care of. All of Colorado, every corner of this state relies on Children's Hospital Colorado. Now a 6-state surrounding states in the Rocky Mountain region almost exclusively rely on us to take care of their sickest children. We are a part of the Anschutz Medical Campus, which I'll highlight just a little bit, has become an extraordinary asset for the state of Colorado. And then I will end with, we are also part of a small but very mighty group of freestanding children's hospitals that are alone in this sea of 6,000 adult hospitals, trying to be focused on children and be the guardians of the health of our children in our country. So it all starts way back when. We have 120 plus years of history of serving this community. The thing I love is that in the late 1800s, this incredible group of women, they said, we got to do better for our children. So they put together a tent near City Park. And you probably can't read the caption, but this was out of the newspaper in Denver at the time. The headline says, New Summer Hospital for Babies. And the tagline says, finishing touches applied by philanthropic ladies, eager to inaugurate the good work. Just those words, the good work that these women were bringing to the children and the babies of Colorado. It wasn't much long after that. They raised enough money. They were pioneers in their own way. They said a tent isn't good enough. The summer isn't the only time children need care. So in the early 1900s, they scraped up enough money, they bought a house. And we now were able to take care of 35 children at a time with a roof over their head. Then, a decade later, they scraped up even more money. And the philanthropic generosity, all of this was done through philanthropy from the community. There was no revenue stream for healthcare back there. This was the community owning this hospital and creating this hospital. So in 1917, we got a legitimate hospital, not just a house. And for a century, we stayed on that in that campus in downtown Denver until we were fortunate enough to have again our community rally with us and help us build our children's hospital that we sit in today on the Anschutz Medical Campus. The first 50 years of this history and this story, again, purely community support. Families like the Tammans, the Betchers, and many, many community leaders and many, I believe, Rotarians were committing resources to support this hospital. There absolutely was no way this organization would have survived unless the community not only dedicated their stewardship of their resources, but the volunteering of the time. 3 wars during this era. And during the wars, the doctors and the nurses were deployed to the war zones. So it was absolutely community volunteers that sat at the bedside of these sick children and cared for and were the essence of the mission of our care proposition and our care value to children. The Great Depression hit. There was no way to pay for health care. When you look back, I've had so much fun looking back into the history of Children's Hospital. They didn't get paid. And maybe there would be, someone would bring food from their garden, and that would be the food they would use to prepare to feed the sick children. So this was completely surviving in its first 50 years of its existence off the generosity and the service of the community in Denver and Colorado. We had also pandemic outbreaks that were going on with influenza and polio. Your organization has done so much with vaccinations across the world to help, and again, aligned missions in how we are helping. But that was a devastating time for children, not just at Children's Hospital Colorado, but around the world. So back then, we were about care and the provision of care for children. The second 50 years of this journey is another really interesting one. We heard Dr. Bob's story and how important sort of the onset of the creation of Medicare and Medicaid and commercial insurance, all of those things actually came into existence only in the second half of the century of Children's Hospital Colorado. Now you begin to have a business. Now you begin to have a revenue stream. And that actually began to really shift what else is happening in medicine. This is also an era when there was a lot of subspecialization of physicians now, and they began to focus on cardiology, cancer, orthopedics, and research started to really become something that the United States of America was driving in a significant way for the rest of the world. So Children's Hospital Colorado was one of the early regional pediatric research centers in the United States. We also began teaching programs for physicians. So there didn't really used to be a field of medicine for pediatrics. It sort of was, they're just small adults. But really during this era, we began to see children aren't just small adults. They have pediatric disease that is unique to their human being. And so how do we really begin to develop and train those physicians? Our foundation started, again, in service and tribute to the ongoing community philanthropic stewardship that had existed. We now formalized how we are supported by the community. In probably one of the most strategic partnerships that has formed in Children's Hospital history, and Dr. Grover knows this, we have absolutely benefited from an incredibly strong partnership with the CU School of Medicine. And the physicians that practice in the School of Medicine have a partnership with Children's Hospital Colorado for pediatric care. And that really propelled us in a very significant way for the place where we find ourselves today. And I found this fun. It wasn't until 1968 that men joined the board of directors at Children's Hospital Colorado. Go women, you ran this place for 100 years and had done it so brilliantly. But it speaks to, again, how community really just embraced, and fearless women were leading through some very, very difficult times. We now found ourselves kind of at the end of that first century, really understanding that we have more than one mission. We're not just taking care of kids, we are also leaders in advancing research and science in the field of pediatric medicine, and we have an obligation and a mission to train the next generation of pediatric exceptional caregivers. Here we are, modern day. We're now in the last 20 years. One of the things that is sometimes not fully understood about Children's Hospital Colorado is we are not just here in Denver, we're not just here in Colorado. We are now seeing kids from all 50 states and 36 countries at last count. So we have become a global destination for some of the most exceptional care that children are receiving around the globe. So our community, I really believe this, propelled us to this world-class status. We would not have made it through those first few years in a tent, to a house, to our first real hospital, through unbelievably challenging economic times, had this community not seen the value and its commitment through service to keep this organization and its mission in its heart and in its embrace. And we have been recognized not just by the programs that we deliver in pediatric care, but we continually are recognized often in the top 4 or 5 children's hospitals in the country for the reputation, and that means both the caliber of the medical staff, the physicians that are here, their research programs, the outcomes in their care. We also have a significant amount of market share, meaning that we are parents are choosing to bring their children to this level of care more so than they even do in other major metropolitan areas where they have a reputable children's hospital. We're drawing from all over the country and the world. The research portfolio now sits at $137 million a year that is focused in partnership with our partners at CU School of Medicine, nursing, pharmacy, dentistry, around child health, and what can we do to find cures, discoveries, and new therapies and modalities. And that truly puts us as one of the absolute drivers of pediatric research and medicine advancements in the country. Now we have 4 missions when we stand here today. The 4th one we've added is advocacy, and I'll talk about that one in a minute. Quickly on the Anschutz Medical Campus. On the Anschutz Medical Campus, you have a number of independent organizations, all separate in their own legal structure and their own missions and purposes, but they come together in a synergy of a partnership. Children's Hospital, the University of Colorado Hospital, our schools of medicine, nursing, pharmacy, dentistry, public health, and a graduate school in the health professions. We also have a practice plan for the physicians, and now the VA is open and active. These statistics are old. These are 2017 statistics. All partners are auditing their 2018 numbers now. I guarantee we have well topped $7 billion of economic development combined between, they say we have now surpassed the ski industry, so just short of the DIA airport, we are now the 2nd largest contributing economic driver on that campus to the state of Colorado's economy. Well over 30,000 employees and growing every single day, and well over 2 million visits are being care points of touch are being touched on that campus. So in a decade, that campus has surpassed, I think, every original partner's set of expectations. And so although independent again in how we function, there's a synergy for all of our missions and how we work and partner together to serve the community. I mentioned that one of the communities we're part of is this small but mighty group of children's hospitals. Here they are. There are 6,000 hospitals in the country, and less than 40 of them look like us. Well, actually 10 look like us, and about 30 of them look kind of like us. But this means that there really is 40 people like myself that every day wake up, and not just within our own organization, but external to our organization, are trying very hard to continue to advocate in a very complicated health policy arena. How do we design health transformation? How do we improve health policy, access, and coverage? It is not always about kids. Even though everyone loves kids, we often get lost in that conversation. And so your Children's Hospitals of America are working very closely together. It's like a sisterhood to really make sure that kids don't get lost in that conversation. The ecosystem of healthcare today, $3.5 trillion is what our country spends on healthcare. About half, these are, I'm rounding up a little bit, but about half are funded through governmental programs like Medicare and Medicaid. About half are in commercial insurance, and we have an aging of America. And so our birth rate is down, our aging is accelerating with the baby boom generation, and the utilization of healthcare is growing at a faster pace than we are keeping up with in the cost and the implications of cost to consumers. So that's why you're hearing so much about healthcare now at a national debate as well as a local debate. It is, when polled, one of the top 3 issues for US citizens today is how to solve the healthcare situation that we find ourselves in. For the last 5+ years, we have been in record consolidation of hospitals into larger and larger health systems. And so that continues. Scale, everyone's trying to get bigger. Disruptive innovation, guess who wants to take over the delivery of healthcare? Apple, Google, Amazon. Those are big competitors when you sit around and think about, I run a hospital, how am I going to compete with the capital assets of a company like Google and Apple and Amazon? And so there's tremendous amount of disruptive innovation, which is good. It's healthy and we need it. But that's going on every day in healthcare. And then we also find ourselves as the second most regulated industry on the planet, only behind nuclear industry. So there's a lot of archaic rules and regulations that lock in our healthcare system. Workforce stress. Our caregivers are undergoing a significant amount of both personal strain and stress on how they continue to deliver care in systems that are complicated and not user-friendly with electronic health records. Fewer and fewer going into choosing the field of medicine. The cost of the education to receive your doctor's degree or your nursing degree is high. And so we're watching high levels of burnout and much higher than average US citizens' suicide rates of caregivers. And so we're very cognizant of how to take care of our people within our family. So children's hospitals then, of those 40, we don't have the scale of those large systems that are all consolidating and merging. We carry an extra responsibility by being one of only 5 children's hospitals in the country that carry the majority of the impact on advancing research and science, and we take that very seriously as a critical part of our mission. That then gets invented here, it gets spread and translated outside our 4 walls. But that initial responsibility and the magnitude of that is quite stunning here at Children's Colorado and CU School of Medicine. Children spend less than 20% of that $3.5 trillion, so they are not the spending problem. But when policymakers design new public policy or commercial insurance plans design coverage plans, or Medicaid programs, think of benefit sets, they are doing it for the 80% of adults, and the 20% of the children get lost in how we shape good policy and good programs for our children. And so the other sometimes often overlooked fact, Medicaid program in our country in the mid-60s was originally created to provide healthcare coverage for pregnant mothers and children. We had just, as a country, implemented Medicare for our elderly, and we decided our next most vulnerable population were our children and pregnant moms. Healthy pregnant moms produce healthier deliveries and healthier babies. That program has now grown to be far more than just its original coverage. And still, though, half of the country's Medicaid enrollees are children, but they never get talked about when we're talking about what's the future and fate of the country's and state Medicaid programs. And so that's that advocacy mission, making sure that that stays in the consciousness of our decision makers. It was really fun for me when I was thinking about this talk and thinking about the similarities of our missions. And, you know, the uncanny connections for how we serve communities as organizations. But I look back in the sort of the missions that you have, your values, service to other, goodwill, fellowship, give back, exchange of ideas, community builders, locally and around the world. Those are powerful words. That's the essence of serving. And so many of the issues that you have taken on as an organization across the world are absolutely, completely focused on children. And even though 25% of our population on the planet, they are 100% of our future. So I end by saying, serving community is loving community. Thank you for loving community, however you define it. And most importantly, thank you for absolutely being such an essential reason throughout decades why Children's Hospital Colorado is so privileged and humbled to serve the hundreds of thousands of children and families that we get to touch every year. Thank you. I heard you're not shy to ask questions. Do we have time or? Okay.
Jena, thanks so much for being here. We spoke briefly when you got here about what Rotarians are doing in the mental health field locally. If you could describe just briefly, you mentioned Children's has a focus on that. If you could just describe a little bit about what you're doing in that area. Thanks.
So one of the saddest situations that we find ourselves in with today's youth are mental health issues. We know that whether it's the onset of social media, the negative conversation that is all around you in media and dialogue, bullying, there is a tremendous amount of pressure on our children today. And we are finding early onset of mental health disorders at the age of 3 and 4. We know that we can also diagnose most mental health issues very early, but our systems are not set up for identification. Our schools are overwhelmed. There still is a stigma, and we have to figure out how to integrate mental health with physical health. So one of the very important priorities that Children's Hospital Colorado is undertaking is not just how can we continue to be a provider of mental health services. Most providers have left the state. There was a 75% reduction in the number of mental health facilities over the last several years. It's mostly driven by economics. And so we find ourselves with few providers of care. Children's will continue to provide those services, but equally important, because you can't build enough inpatient mental health beds or enough outpatient mental health clinics to take care of our problem. We're holding hands with our community. We're finding there are significant number of community organizations and partners that are also trying to address this very concerning problem. And Colorado's statistics are some of the worst in the country. We live in this gorgeous place. This is a wonderful place to live, but yet our children and the statistics of suicide rates and mental health issues in Colorado's children are truly some of the worst in the country. So we are convening a group of individuals, building a collaboration and partnering very, very closely with the state of Colorado to try to change laws, change infrastructure in the state that has fragmented these agencies and these programs into total randomness, and they're not serving their core purpose. And so that is one of our really very, very important priorities and commitments to our children.
Could you talk just a little bit about supply and demand? Are there more children who are requiring or applying for services than you have room for?
Sometimes, yes. So we've been very fortunate. When our community helped us build the new facility that we have on the Anschutz campus, we equally built other programs. We now have 16 addresses, so 16 campuses. We are pretty much able, with the exception of mental health, to meet the demand that we are facing from children coming in various programs from all over the country. We closely watch and track when we need to grow. We still have some physical capacity to grow. We're also opening a brand new hospital in Colorado Springs later this spring. And then, yes, like right now, we call this our peak season. Kids get respiratory illness with the flu, and we can run out of beds and or caregivers on any particular day through the course of the winter. But averaged over the year, we're able to build capacity only as needed to try to keep up with the supply or the demand. Yeah, so we have 16 campuses. About 4 of them have hospital beds, and the rest of them are really outpatient. One of our goals is to try to not admit children into a hospital stay unless they're really acutely ill. So we do both. We are trying to manage children in an outpatient setting as well as hospitals, and so that's the blend of those 16 campuses.
Jena, could you talk a little bit about the Children's Hospital Colorado Foundation, the role that it plays, why it's necessary, and is there any truth to the rumor that if we donate to the foundation, we'll live longer and have a better chance of getting to heaven?
You said it, not me, but I'll go with that. I like that. The Children's Hospital Foundation is exclusively exists to support the mission of Children's Hospital. So 100% of all of the donations that our community so generously shares goes to support our hospital. We had one significant campaign in our history to build the hospital. It was about $250 million campaign that our community helped us raise to help move into the new place. And just at the end of December, we closed a $434 million campaign that really is about people and programs. The only way to fund a mental health strategy, the way we're doing it, is through philanthropy, because if you look at it just as a pure business model, you'll do what those other 75% of the businesses did and close it. They are helping us fund innovation so we can figure out how to transform care, get into homes. Most of health conditions are based on the social determinants of health, not the physical. So we don't get paid as a hospital or any hospital to take care of the social determinants of health. Your diet, your exercise, do you feel safe in the community you live in? Are you in clean conditions and have sanitary water? All those things. So we use philanthropy to help us design very innovative care models to take care of the most vulnerable children and bring them access to services that impact their physical health. So it is an incredible partnership with our foundation, and yeah, it might be good for the soul.
I thank you for coming. Both my sons have benefited from your services. This is a question about childhood obesity. I took a tour of your hospital soon after it was built, and I was surprised and depressed to know that some of the limits that you were gauging for the equipment that you had were taking care of kids up to 600 pounds. Has the last couple of years about a slowing of the rate of obesity among children? How does that affect the treatment modalities you have and your research?
Yeah, we're very fortunate to have some extraordinary collaborative research going on. So some of the most interesting research is putting a bariatric surgeon together with a pediatric cardiologist, together with an endocrinologist, and what they're discovering is obviously diet and exercise are essential, but there is some genetic markers and some genetic dynamics. And we've got some fascinating research going on with the ability through a bariatric surgery on a child to actually reverse some of the diabetic trends that trigger. So we're researching all kinds of interesting things. So research is obviously one field. The other thing we use a lot of our philanthropy with is programs. So we adopt fifth graders all across the school districts and have them enroll in exercises, meaning we'll give you a free bike, and if you demonstrate to us you use the bike so many hours a week, you get to keep the bike. So it's behavioral economics, reward for doing the right thing. We also, fourth and fifth graders are fabulous experiments. So we also have nutrition programs. We teach the fourth and fifth graders how to eat better, find home, and all of a sudden they're just not eating better. The whole family's eating better. So chicken on Wednesday night, it's grilled chicken. There's some fish that shows up. And